And welcome to our talk on smoking cessation for cancer patients. I'm Karen Arthur. I am the Director of Quality for the Comprehensive Cancer Center. We're talking about this today because we wanted to share the importance of smoking cessation in newly diagnosed cancer patients. We wanted to share some information and reasons showing you why cancer patients should stop smoking beyond it's just bad for you. We know that many diagnosed cancer patients who smoke believe that stopping smoking at the time of diagnosis will simply increase their stress and that they'll stop later. And we want to show you and share some of the data and facts that emphasize that stopping now really makes a difference. We want to review our current programs, and we want to specifically talk about what you can do to help cancer patients stop smoking. Next slide. Our panel today are Dr. Lila Chelaby, Assistant Professor of Radiation Medicine at Northern Westchester and at Phelps, Jennifer Lucas, Respiratory Therapist, who is the coordinator for our smoking cessation program here in Westchester, Linda Caffrey, a family nurse practitioner who runs our lung cancer screening program, and Sue Vranikoski, our nurse who's a health and wellness navigator at the Cancer Treatment and Wellness Center. So I am going to turn it over now to Dr. Chelaby. Lila, it's all yours.
Thanks, Karen. So we all know that the three pillars of good cancer treatment are surgery, medical oncology, and radiation oncology. Add to this supportive care through our health and wellness program, and you get better cancer treatment. But we feel that the best cancer treatment also includes smoking cessation for our cancer patients, and we'll let you know why. Smoking affects multiple cancer outcomes. Biological outcomes are affected through increased tumor promotion through continued smoking and decreased cancer treatment efficacy. Clinical outcomes are therefore impacted as increased recurrence rates have been noted. There's also increased toxicity from treatment in patients who continue smoking and also increased mortality. This in turn impacts the value outcomes, such as decreasing quality of life of our cancer patients, decreasing their extent of life, decreasing their productivity, and in addition, it increases the cost of healthcare significantly. Next slide. There are a number of reasons that smoking cessation is important for our cancer patients. First, compared to non-smokers, smoking at diagnosis has a 61% increased overall mortality, and smoking at follow-up has a 113% increase in overall mortality. Smoking cessation after diagnosis is associated with a 45% median reduction in mortality, and smoking after diagnosis adds about $3.4 billion in cancer treatment costs annually, and this is based on a 2019 estimate. Next slide. So we've conducted a survey internally at Northwell and found that we're actually really quite good about asking patients whether or not they smoke and advising them to stop smoking. However, we are not as good at documenting a plan for their smoking cessation, counseling them and referring them to supportive services as needed so that they truly are able to stop smoking. Next slide. So we offer some strategies to assist our patients with smoking cessation. First, we plan to make literature available for providers and patients and distribute them in physician offices and throughout the cancer center. We encourage providers to review smoking status for all patients presented at Tumor Board, and we're going to refer current smokers to Jen Lucas for evaluation and to Linda Caffrey for screening CT scans as indicated. Expedite direct referrals to smoking cessation programs and low-dose lung cancer screening programs, as well as develop other pathways for referrals. So we would highly encourage all oncology staff to be aware of current smokers, to encourage smoking cessation, to assist in providing literature and referrals, and to ask and document smoking status at every follow-up visit. Last slide. And here you can see an example of a poster that we're hoping to distribute throughout the Cancer Institute and in physicians' offices to inform patients as to why they should stop smoking and offer them resources to help them with smoking cessation. Thank you.
Hi, my name is Jennifer Lucas. I'm a registered respiratory therapist, and I am the smoking cessation program coordinator for Northern Westchester Hospital and Phelps Hospital. I wanted to provide options for you to give to your patients. We have a few that we're going to discuss today. One is the Westchester-based option. So presently, we are holding meetings via Microsoft Teams. We do offer group sessions for people. They are given 3 evenings per month for an hour each session. I run the meetings every week, and individually, we will develop a quit plan with each patient, or individual, to help them stop smoking. If patients are not able to attend these group sessions, then I will call them on the telephone, we email, we do whatever it takes to get them the help that they need to stop smoking. We do follow up in between session. Each participant, if they're interested, will provide me with an email address or a telephone number, and I will contact them in between the sessions to provide extra support. Every session we do discuss different things, but just to give you some examples, we talk about their triggers, we talk about why they smoke, we discuss all the FDA-approved smoking cessation tools that are available and what works best for them, whether it be cutting down, quitting, using nicotine replacement, using medication. We discuss whatever options are available to them. Next slide, please. The second option that we have is the Center for Tobacco Control, which is a Northwell program. Their enrollment is done by the participants either via phone, they can also have a telehealth visit, and then they will get an invitation to join their groups. Their classes are run by a nurse or a nurse practitioner. They do provide individual education and coaching, and they also provide a quit plan for their patients. Northwell Center for Tobacco Control has the ability to provide nicotine replacement, and they can do that either by providing a prescription for their pharmacy, or the Center for Tobacco Control staff can help them get nicotine replacement. If you have the ability to use Allscripts, you can actually provide a direct referral to the Center for Tobacco Control through Allscripts. And this program also follows up with their patients in a couple of weeks after each session. Next slide. The third option that I wanted to present to you is the New York State Quit Line. Group sessions are not for everybody, and we understand that, so we wanted to make sure that they have another option available to them. The New York State Quit Line is a free program. It gives you access to a quit coach 7 days a week. You can call them, you can chat with them, you can text them. Their hours are limited, so 2 o'clock in the morning you will not be able to get somebody, but they also provide nicotine replacement therapy in the form of patches. There is a phone number that can be called and a website that can be accessed for patients to get more information.
Hello, everybody. My name is Linda Caffrey. I'm the nurse practitioner for the lung cancer screening program at Northern Westchester and Phelps hospitals. The reason to refer patients for lung cancer screening are quite staggering. The American Cancer Society estimates that over 236,000 newly diagnosed cases of lung cancer would occur in 2022, with over 130,000 deaths. Lung cancer screening can reduce mortality by up to 20% in high-risk populations. Nationally, lung cancer screening rates are low. New York State screens less than 7% of the eligible population. Imagine how many lives we could save if we were able to increase that screening rate. Next slide, please. The criteria for lung cancer screening is as follows. Eligible patients are 50 to 80 years old. Medicare will cover those 50 to 77 years old. Patients would have a 20 or more pack year smoking history, either be a current or a former smoker. If they are a former smoker, they've quit within the last 15 years to be eligible to enter the program. Finally, they have no current signs of lung cancer. As a side note, we do offer a $250 flat fee for patients who either don't have insurance or who have a high deductible. Next slide, please. When ordering, please use CPT code 71271, and I've listed the preferred diagnosis codes. These are smoking-related diagnosis codes and oftentimes are better accepted by the insurance companies. The shared decision-making visit with me includes a discussion regarding smoking cessation and referrals to available programs if applicable. Please note that not all patients who meet criteria should participate in the lung cancer screening program. Some may be too ill. Some may have had a chest CAT scan in the last 12 months, or there may be other reasons not to be scanned. Please discuss any potentially eligible patient with the provider directing the patient's care prior to referring. If you'd like to refer a patient to me, you can task me through Allscripts, email me, or have the office or patient call 833-586-4727 to schedule their appointments. Next slide, please. This is our tear-off sheet that's available for distribution to patients. Thank you for your time.
Hello, everyone. I'm Sue Veronikoski. I'm the Health and Wellness Navigator, and I'm also a Duke Health and Wellness coach trained through Duke. And I am here in the Cancer Center, and I'm happy to speak to you today about our smoking cessation modalities as well as the Health and Wellness program. So for smoking cessation, in the future, we are planning some health and wellness modalities that are specifically for the smoker who's trying to quit, which would include acupuncture, meditation, and other services. We have a health and wellness program, and it's a free grant-funded program for patients that have a cancer diagnosis and who have a physician with privileges at either Phelps or at Northern Westchester Hospital. Patients will meet with me. I'm a health coach, and they will be able to enroll in the program. And the services we offer through the grant are nutritional support with our registered dietitian. We have integrative medicine modalities, a fitness program such as yoga, tai chi, qigong, and meditation classes, which are right on site. And we offer one-on-one support with a psychologist or psychiatrist. I just want to note a special note that patients do not have to go through the health and wellness program for the smoking cessation services. Thank you.